It is just a huge honor today to be podcast interviewing King Clifford, the king of endodontists, with his lovely wife, Phyllis, who is, you guys are going to be celebrating 53 years. Do you have any teeth left that aren't root canaled?
He doesn't. I'm fine.
You're fine, but you have 5 teeth left?
I've had 5 root canals. Yeah, I got 5 teeth.
Well, Phyllis, my gosh, they say behind every successful man is a successful woman. I mean, everybody knows that no one would know who Gordon Christian was if it wasn't for Rella. And I don't want to piss off King Clifford, but is that kind of true of King Clifford too? Would I even be podcasting him today if he did marry you 53 years ago?
He would admit it's true. Yes.
Yes, well, absolutely true.
So what's your advice to, there's a lot of kids, 25% of our viewers are still in dental kindergarten, and the rest are all under 30, and a lot of them are going to be getting married someday because that's the fastest way to go broke. I mean, marriage is the #1 cause of divorce and bankruptcy, but what advice would you give to a spouse supporting a dentist?
One day at a time and a sense of humor.
Nice.
Period.
You forgot the Jameson in the morning, but or you just use regular Listerine and then swallow it after you're done swishing.
Oh, God. You are bad.
My gosh, but congratulations, 53 years, 2 children. Any grandchildren?
5.
5 so your 2 turned into 5?
Yes.
My
the oldest
gosh.
one is 21. 21. Yeah.
The oldest grandchild?
Yes.
Wow, that is amazing. Well,
and
congratulations.
he does the Ruddle show for us. He's the behind the scenes.
The shooter.
Well, can you do me the huge? Will you? What's his name?
Isaac.
His first name.
Isaac Kirschner.
Isaac
Kirschner.
Isaac Newton Kirschner.
Something.
Isaac King.
Actually, it's Isaac Clifford Kirschner.
You forgot the Newton, but Cliff, if I was going to substitute out Sir Isaac Newton's name for something, I would go with King Clifford too. But, in the endo section on Dental Town, it's one of the most amazing sections. And Fred Joyle, who lives out there by you, says marketing is everything. But when you go to YouTube, there's a share button where you can post a link, but the next button over is embed. You can copy that embed and you can drop all of his endo shows in that form, and then when they click that, they'll go to your YouTube channel, and dentists always subscribe because so many people, they were having a lot of views but didn't have a lot of subscribers, but the homies want it because it just makes it technically easier. But if he could upload some of those, because I love those videos. Endo is, as you saw the survey from the ADA, of the 12 specialties, the one that general dentists don't like to do the most is endo. And half of the dentists don't do molar endo, and they got $400,000 of student loans. The insurance is, it's a high dollar procedure. Insurance pays 80%. I'd have to sell you on veneers, but you don't have to sell someone on a root canal. So anything we can do to promote the knowledge of endodontics is important to me from a public health dentist perspective, because when I'm from Kansas, Clifford, I was born in Wichita, Kansas, same place Clifford's dad was born. And it's kind of funny that your dad was a minister and my 2 sisters are nuns. That it's a really religious area. But when you're in a small town and you got a toothache and you go to the doctor, the dentist, and they can't do a root canal or extract the tooth, I'm so mean. I think you should hand in your license to any foreign trained dentist living around the world that could come to your town and pull the damn tooth or do a root canal. And I would close down every state board of dentistry if we could just do that, so that public health people have access. You can't say you're a dentist and not get people out of pain with an extraction or a root canal. And if you say you just want to do bleaching, bonding, veneers, then go be a Botox queen in Santa Barbara, California. But you're not. We don't need you in Wichita, Kansas. We need real dentists that can get people out of pain.
Yeah.
Absolutely.
So yeah,
okay.
I bet you every time he posts a YouTube video, within a week he'll see how many each post bumps his subscribers.
We appreciate it. It's biggest on Facebook right now, just because I have 3,000 friends in India, and it just goes wild.
Don't get Howard started on India, because we have a lot of mutual friends in India.
I stopped Facebook February 8th, when the pandemic hit, I had 300,000 followers, and I had to readjust my time, and the first thing to go was Facebook. I haven't been on since the pandemic, and I have no intention of going back. I mean, it's
it's a crazy.
How many times do you have to lie, cheat, and steal before you finally say, you know what, there's TikTok. I'd rather go with the Chinese TikTok. I would.
Gosh.
I would. I mean, I think
we haven't gone there yet. Maybe that's next.
Oh my God! It'd be safer than the Americans do, because the Americans are so highly technically advanced that if someone was going to steal you blind on the internet, it'd be the Americans in Silicon Valley. It wouldn't be China. We've both lectured in China. But Phyllis, congratulations on all you've done, and thanks for turning little Clifford into the king of endodontics. And
thanks. Well, we didn't plan
Phyllis,
that.
one last question, Phyllis. One last question. Everybody always wants to know where Clifford bought his wig. I mean, obviously it's not real, but I mean, do you glue it on? Is it tied in?
We got it from Fredericks of Hollywood.
Oh, you are bad.
You heard it first on Dentistry Uncensored. Cliff Ruddle obviously wears a wig. My gosh, that was, well, here, I got to formally introduce you. Endodontist Clifford J. Ruddle, DDS, FACD, FICD, founder of Advanced Endodontics and The Ruddle Show, is internationally recognized as a leading expert in all aspects of clinical endodontics. Dr. Ruddle is acclaimed for providing such superb endodontic education to his teachings, clinical articles, training manuals, and multimedia products. He's the founder and director of Advanced Endodontics, an international education source in Santa Barbara, California. He created the world's first private microendodontic simulation training center in '89 and has trained several thousand dentists, microscope-assisted endodontics techniques. He is well known for his ability to empower colleagues and motivate clinicians toward their full potential. Additionally, Dr. Ruddle maintains a private practice limited to endodontics. Is a fellow in both the American and International Congress of Dentistry. He's also an assistant professor of graduate endodontics at Loma Linda University and University of California, Los Angeles. Is an associate clinical professor at UCSF and is an adjunct professor at UAP. He's also previously served as a consultant to the Long Beach VA Medical Center. Come on, I only got one more paragraph.
God, Howard,
and is
please,
currently an
endodontic
endodontic fellow of Harvard University. He has been a member of the Omicron Kappa Epsilon Society since '71, Pierre Fichard since '87, serves on the Dental Advisory Board for Endodontic Practice and Dentistry Today, and the Editorial Advisory Board for the Journal of Aesthetic and Restorative Dentistry. He received his dental degree from the University of Pacific School of Dentistry, along with Bill Dorfman. In '76, he completed his postgraduate work in endodontics at Harvard School of Dental Medicine. That is impossible to get in. Cliff and his wife, Phyllis, who you just met, live in Santa Barbara, the home of Advanced Endo. They have two daughters, Lisette and Lori. Lisette and Lori, also living in Santa Barbara with their families. Cliff and Phyllis are very proud of their 5 grandchildren, are excited about the great joy they provide. He has been married to his now this, when I asked Phyllis for your bio, she only sent me one paragraph. I asked Phyllis for your bio. She sent me this last paragraph. She just said, Dr. Ruddle has been married to his incredible wife, Phyllis, for 53 years and has 2 fabulous daughters and 5 amazing children. That was the only bio she was going to give for you.
Well, that's what you were supposed to say, and that's what you promised to say, and the rest was just bullshit.
Oh, my gosh. But you've done so much for me personally. You've done so much for so many. In fact, my last name starts with F, so Ferran Gottleman. I think Brad Gottleman is he's in a league with you, I believe. I really believe that. And he just thinks the world of you. I mean, Brad, if you say Ruddle in front of Brad Gottleman, I mean, you can just see his heart melts. I mean, you've been a big impact on so many people, and I think it was your teaching that led Brad. Now he walked away from the most successful endodontic practice in Glendale, Arizona. Now he's teaching endo, and that's probably you probably should take credit for that.
No, I don't take credit for that, but I've known him for decades, and you can tell him, maybe he'll listen to this, but you can tell him he disappointed me. And how he disappointed me, he was one of the 20 years ago, I saw him as a young Cliff Ruddle, and I thought he was going to go way beyond me, because that's what I always want, is your students should go beyond you. And then I found out he quit teaching. But then when he told me why, it totally made sense. He said, I have young kids, I have a family, and I just can't travel and move around. Then I saw him more recently when I was down in your neck of the woods at the Western Dental School?
Midwestern. Midwestern's in Glendale, and A.T. Stills over in Mesa.
And then he told me on that trip he was getting back into it. He was really excited. So no, he hasn't disappointed me. I just want to say publicly, he is an expert clinician. He knows a lot about disassembly and taking teeth apart, because for many endodontists, our normal fare is redoing other people's work. So he's very good at that.
Yeah, and did you know my other roommate was Joe Dubkin, an endodontist out here.
Oh.
We both were on the 9th floor of Creighton, along with the other dentist who's now a congressman in Flagstaff, Arizona, in the U.S. Congress. And but yeah, Dubkin was another endodontic freak. He was a math physics freak in Creighton. You know, when it's 2 o'clock in the morning, you couldn't do a geometry problem. You just walk into Dubkin's room. But say a few words about Joe.
I'll tell you a quick story, because we have some common friends, because I gave you some information recently on a guy named BJ.
Ben Johnson.
So anyway, I was down at the Scottsdale Center. I was at the Scottsdale Center for Dentistry, and I was their endodontist. And so I had a faculty, and they would fly in. We'd pay them a little stipend to help me with the groups. Dubkin was in the hospital. So the story is, at lunchtime, we found this out, because he had been traveling a lot for his medical care, and he was now in the hospital locally. So Ben Johnson got in a car, I got in the car, Tom McClammy got in the car, and 2 or 3 other people, and we went over during lunchtime and spent a lunchtime with Joey. So that was the last time I saw him.
In the hospital?
Yeah.
Yeah, he had the same thing that the founder, Sam Walton, the founder of Walmart, multiple myeloma. And I thought for years he was going to beat it, but just didn't beat it. It always reminds me of Dwight Eisenhower. He says, every time we build $1 billion aircraft, we could have built 100,000 homes, and we might have cured another disease. And it's just, it's just so brutal when those diseases take out people like that. I mean, when we walked into Creighton in 1980, this is before computers, internet, anything. He had like 3 different calculators hooked up to a printer, and then he bought some deal from Radio Shack or whatever. But I mean, the guy was just, nobody knew math and physics more. He was a mathematician, physicist who happened to be an endodontist.
Yeah.
And you can't, I mean, his level of physics was, I mean, it was so easy when he explained it to you. Then when he walked out of the room, you're like, what? He was amazing. I want to start this show off. The first direction I want to take this is what's real on the ground. And that is, we just had 6,500 kids graduate from dental school 3 months ago. And they're very stressed because their clinic time was cut short, and a lot of these people never obturated a real tooth in a real human. I mean, not one. And then if you go back to say, and a lot of them say, I wish I would have graduated a year before. It's like, okay, well, let's take that, because even that's a joke. When Brad and I were at UMKC, we had 6 full-time endodontists on faculty. And there wasn't that many kids. I mean, you could have endodontists help you everywhere. And then you go to these private schools that are $100,000 a year. They got twice as many students, and I'm not making this up, 1 endodontist full-time. And then they come out of school, and my endodontist friends out here say, what is wrong with these schools? I mean, these kids that came out in the last 10 years, they'll call it, and I'll say, well, did you pulp test it? No. Did you electric test it? No. I mean, they say they don't even know the basics. I mean, grammar school endo basics that you would have to know for your first 100 root canals, they don't know. Do you agree with this assessment or not?
Howard, 3 times in the Journal of Endodontics in the last 5 years, we've had articles on the crisis in endodontic education. So it's just like you said, the kids are going to school. Think of when you and I went to school. So I kind of went through in the 70s, and you went through a little bit later, but think about what we learned. And you mentioned the ratios of faculty to students. So you got deeply baptized, if you chose, into any discipline within interdisciplinary treatment. But now The kids have, we didn't have retreatment when I was in dental school. We didn't have implants when I was in dental school. We didn't have CBCT. We didn't have lasers. We didn't have all this stuff. And now they're getting it all into dental school a little bit. So I think they get exposed to a lot, but they're not mastering fundamentals. And so what happens is they kind of get pushed along. And then when they get out, don't get me started on some of the endodontists as an example, but we have kids that can't really negotiate canals anymore. They hope magic technology will overcome deficiencies in primary training. So we do have a crisis in education, and we have a lot of responsibility with the kids because endodontics has changed just like every other discipline's changed. It's not just, people used to say to me, don't you get tired of doing this all day long? Well, that's just a very small part of what a clinician does. So we have to do a lot of things from diagnostics. We have to learn radiology again because the CBCT, a lot of dentists have trouble differentiating the slices, don't want to see too much on their field of view. They're not trained to see that. And then, of course, we're going through all kinds of restoratives because as restorative dentistry's grown up, we're going through third and fourth generation adhesion dentistry products, and we're going through glass of all kinds. Metals have improved. And so anyway, everything has changed and everything is different, and it just takes time. And the kids really aren't learning that, and they're not doing very much redundancy in dental school. So that's a quick overview.
So finish the sentence for me. If a dentist bought $100,000 pair of golf clubs, they won't magically turn into Tiger Woods. Same as a dentist buying what for endo?
You want me to put a blank in?
Yeah, fill in the blank. Same.
Dental wave.
Dental wave?
Yeah, that's
God,
controversial.
man, you're as politically crazy as I am. I mean,
well, do we need
that's
a
why
70,000?
That's why I did a morning show. I didn't want to get you after 2 cocktails at 7. I wanted to get but man, straight up in the morning. That was a bold statement, and I love it. But go ahead. You were gonna say more?
Well, I'm going to say 2 things. Gentle wave is exceptional technology, and it can actually clean a root canal system. And that's the end of my polite remarks.
And how much does dental wave cost?
Well, you might think it costs 70 grand to get a unit, but if you really stop and think about it, you have a throwaway handpiece that's about $100 per patient. If you do big volume, you can get it to 75, so I'm fair. It can be as high as 125, but you're paying about $100 per patient for a handpiece. Then when your unit crashes, you realize, oh, gee, I need to have some guy come out and fix it. Well, then they'd say you need a service contract doctor because it's pretty expensive to get to your state. So then you have to sign up, I think it's, don't quote me, $4,000 a year for the service contract. And the point is there's other technologies around the world, or if your audience is really listening, that can clean a root canal system for a few pennies. So the great travesty to me is to sell a $70,000 unit to do something that they say has never been done before, quote, clean root canal systems, when in fact many of us for 50 years have been cleaning root canal systems. And we have, before Photoshop, Howard, we have cases that have been recorded, published, and disseminated around the world showing filled root canal systems. For every canal I shape, I feel about 2.8 portals of exit associated with every one shape. So it's kind of funny as a teacher. I'm getting close to 50 years of doing this, 48 years, but you'll find out that thousands of dentists have been trained to carefully and appropriately shape canals. They've been able to use a 25-cent handheld syringe. They can flood these shapes with a critical reservoir of reagent. We can use low-tech technology, and we can agitate these intracanal solutions, and we can move them so they penetrate, circulate, and digest tissue from the uninstrumentable portions of a root canal system. So the thing is, a lot of young dentists get out and they go, gee, I saw a case that McClammy did, or Ruddle, or John West, or Mosh 2, or somebody that they admire, and they go, look at all that anatomy. They've never seen it in their life. So they come to a gentle wave congress and they find out, oh, if I get this, I can now do what I've never been able to do before. So there's a website called Doc Matters. You and I can't go there, but I get there because, well, you have to buy a gentle wave unit so you can go to their website, and then they have a eclectic group of people who post their cases. I have never seen such average, mediocre cases, and that's the normal fare. Because a lot of these young dentists go, well, I couldn't get to length. I tried 2 boxes of 10 files. I couldn't get to length, so I hooked on my manifold to my tooth, and I used my gentle wave, and look what I did. It did what I couldn't do. So sometimes it sucks out the pulp, Howard, and that leaves space, and space is availability. We can push obturation materials into empty spaces, but if we don't pull the tissue out, it remains occluded, obstructed, and you're not going to drive your filling materials into these filled with bacteria, tissue, pulp, and degenerative byproducts. So I just don't like the model. They have a model, Howard, in marketing. If we got into marketing, they go into this whole thing like you shouldn't refer, if you're a general dentist, except to an endodontist who is a gentle wave user. In Canada, they said it was the standard of care, and if it wasn't the standard of care, it was at least the practice of care, clinical practice of excellence. It's all wrong. Your overhead light isn't the standard of care. Your dental handpiece isn't the standard. It's adjunctive treatment, and they're trying to make like a message around it. It's almost like let's go drink the Kool-Aid and get our gentle wave units and have our annual meetings, and it's a little group. Some of them, Howard, are very skillful people. The skillful people are using gentle wave beautifully. What I'm worried about is a lot of people are buying it because they can't do what they never learned to do, and so they think this is the way to do it, and they're doing very mediocre work. It's an embarrassment to endodontics. That's pretty harsh talk, but that's what I have to say about gentle wave.
Okay, my problem with everything you just said is that my dental kindergarten students don't even know what a dental wave is. So will you go back and just tell them what you're talking about? What is dental wave?
Okay, gentle wave is a Ruby Goldberg machine. It's probably about this wide. It's probably about 3 feet, 3.5 feet tall, and it's maybe 2.5 feet deep. So it takes some operatory space. If you open it up, it has a bunch of bottles of reagents and hoses and valves and microchips, and it floods irrigant from that machine through a hose through this handpiece that you throw away. You put a donut around the tooth you're working on of some kind of a general dentistry, like a putty material. The handpiece seats in the putty to affect a seal. You turn on your machine, and through about an 8-minute cycle of these various reagents coming in at a prescribed cadence, you clean a root canal system. When you take the lid off, take the donut, the putty out, then theoretically you dry the canals and fill the root canal system. So it's a way to circulate fluids in a very voluminous way through a root canal system.
It reminds me of our good buddy William Ben Johnson from Tulsa, Oklahoma. He sent Brad Gottleman. Ben paid a lot of money, and he found the oldest root canal video filmed in 1917 by M.L. Rain, M.D., DDS.
Yeah.
And you've seen that video, I'm sure, 1,000 times. And it was just the basics. They didn't have any technology, but they isolated it. They found all the canals. They cleaned it. And I remember in endo school, in dental school, when the endodontists talking about, when someone asked about silver points, they'd say, if you find all the canals and you get it all cleaned out, you could fill it with bird shit as long as it was sterile. And now people want to say, well, I don't want to do all the find the canals, cleaning and shit. I don't want to get an A on the basics. I'm going to solve all my Tiger Wood golfing issues with a $100,000 pair of golf clubs. And I would rather you just learn how to golf with some used clubs from your grandpa, not, just learn how to golf.
Yeah, I know you heard me, but just to be clear for our audience, because, you get sued on this stuff all the time. It's hard to even be a speaker anymore. In the old days, you and I could disagree vehemently on something, go down and have a beer at the end of the day and give each other a hug and head off to our respective homes. Anymore, you just get a note from the attorney. So I want to just say, gentle wave can clean a root canal system, but it isn't to make up for deficiencies of not being able to find canals, not being able to negotiate canals, because part of gentle wave is non-instrumental technology. In other words, minimal shaping of the canals. Well, that's a very noble thing to say, because we all have seen shapes that are too big. we know shapes can be too small, and then there's shapes that are appropriate for the roots that hold the canals. So they've been emphasizing minimally invasive, so their colleagues are afraid almost to stick a file in the tooth because they don't want to remove any dentin. But if you I've talked extensively to Coyce, Frank Spear, Sherilyn Sheets, some of the great restorative dentists around the world, and the ferrule effect is most important on the buccal lingual. That's where we have our work and balance and go into these different movements where we put shear forces on teeth, and that's what can break roots. Well, when you remove a triangle of dentin on the mesial of a molar, as an example, the mandibular molar, the mesial triangle of dentin, when you remove that triangle, it really removes a lot of iatrogenic errors. It gives colleagues a better chance to negotiate and slide instruments passively in the more delicate apical 1/3. They teach leaving the triangles, minimal instrumentation. So a lot of things have to go right. And if you're a master clinician, you can make the structures in place to do the workarounds to overcome that. But see, one of the things that we're not talking about is the triad. And a lot of people like to laugh at the triad, so I'm going to say it anyway. The triad of dentistry is, Howard, some kind of a shape. We might not agree on it, but we're moving files. So if we move files and cut dent, we're making some kind of a shape. The second thing we do is some kind of irrigation to clean and some kind of a filling method. So the trifecta is shape, clean, fill. And so when you affect one aspect of that triangle, you upset everything else in the triad. So right now, minimally invasive endodontics has invited obturation problems because the canals are so small that the armamentarium doesn't fit below the orifice. So it's led to abusive techniques and single cone use.
God, you're so profound. It just flows out of you. So the endodontic triad is shaping, cleaning, and obturating. Yeah. So, but I just want to clear up. John Coyce, Frank Spear, and Sherilyn Sheets all agree that the most important.
Your circumferential ferrule is most important on the buccal and lingual. And you're a restorative dentist, so that would make perfect sense to you. In other words, mesial and distal, there's not a lot of loads that are moving teeth anterior, posterior. They're being rocked back and forth, and loads, occlusal loads over 1,000 psi, occlusally and obliquely, and different vectors of force. But basically, the ferrule is most important on the buccal and lingual. So I mention that because it's the mesial triangle of dentin that I've been teaching, and many others like me, to remove, because it gives colleagues radicular access and it helps them slide instruments delicately and consistently and predictably to length. That's what great endodontics is. And then once you get to length, we can argue all day how big should the shape be. We can argue all day what's your disinfection method, but we got to at least open them up, find the canals, and try to catheterize them. Let's just say today we could stop on, could we just learn to catheterize canals?
And that ferrule effect, I think the easiest way to teach it to a newborn kid is that when they start barrel making, then when they start stacking the barrels, they'd all explode. And they learned to put, that's where the word ferrule came from. It was a little 2-inch collar of metal around the barrel. And then if you really wanted a good barrel, it'd cut, instead of just a half, then it cut the two equators in half.
Mm-hmm.
And if you have 2 millimeters of tooth all around that prep, that's why you have retention. But again, a lot of dentists, they don't want to do crown lengthening. They don't want to do a ferrule. They just want to stick a big post in there.
Yeah. We really love, don't get me started, but there's this guy named Denny Southard, and he talks about glue. I won't even go into it, but everything can be glued on. Glue it. You don't have to have mechanical ideas anymore. You just glue it, and it all works. But, there's different coefficients of expansion between different materials. These things move constantly during life. There's loads. Everything leaks, right? So, we just try to slow things down from a gallop to a trot.
That is nice. So yeah. So, when they come out of, the dental school tuition is amazing. When you look at, the big flag and giveaway is that when you look at the Federal Reserve data and, most, inflation 1.5%, 2.5%, 3.5% around the world since they've been tracking it. But when something starts it leaves the consumer price index like this cost of education. The CPI is almost like a straight line, and then dental education just goes off the charts. And I can still remember when, dental school, you still had a lot of $6,000 and $10,000 a year dental schools you could go to. And then it was 20, 30, 40, 50, and then before you know it, you couldn't even remember in your head all the schools that had passed the $100,000 mark. And it's just so when these kids come out of school with $400,000 of student loans, if they just buy a CBCT, a laser, a CAD cam, and a dental wave, I mean, you just doubled their entire cost of tuition.
Huge.
Yeah.
I don't know the model. I mean, you're the businessman, and I guess the whole world that's listening to us knows who you are. But Howard, I'm telling your audience this because you know you did this, but many years ago I met Howard, and we maybe talk about that, maybe we don't. But one of the things Howard did for me years after we first met is the USP guy came, and there was this great big package from Arizona, and it was your MBA tapes. And I have a whole series, like in my library at the office of MBA. But what I was going to say, these kids have so much debt. And then it's, do they go into private practice? Do they associate? Do they go to a DSO? So we're seeing a massively changing model. And it's interesting just to see that around the country. I'm seeing more and more endodontists come up to me, young ones, they're going, "Hey, Cliff, is it okay? Can I join that one?" And so I think the debt is driving the future of dentistry.
Oh, they're indentured servants. I mean, the only thing new that's going on is the history you didn't learn. And this is a play from an indentured servant. They really preyed on Ireland a lot, where my family tree comes from, and they'd offer them these great jobs that you're going to have to work on that farm for 7-8 years. And these dental, a lot of the history that these kids listening don't know is that when Ben Johnson was endodontist, he didn't go to endo school. Wasn't he just practice limited to endo? Same with John McSpadden out of Chattanooga, Tennessee. I mean, they didn't go to an endo program, right? They just practice limited to endo.
Ben did, but John didn't. But you're
Ben
right.
Did?
In that era.
Oh, that ruins my hero story about Ben. I wish you would have never told me that.
I'm pretty sure, didn't Ben go to grad school somewhere?
I thought he did. Yeah.
I think he went to East Jesus U or something.
East what? East Jesus U? but even there, when the endo program started, it was 1 year. And then the faculty's looking at your future earnings, say, "No, we better make this 2 years." And now they're looking at it, say, "No, we better make it 3." Well, why don't you just kidnap him, chain him to a chair, and work like that? I mean, the dental schools don't have one eye on the student and one eye on cost. They have one eye on the student's future earning potentials, and they're trying to steal all they can legally.
Wow. What you just said is something that is very dear to my heart because, well, don't get me started on education in general. We could start at the universities and look at what's happened over the last 25 years at the university, that most people that mortgage their house to send their kids to go there to get propaganda. We could talk about grade school. We could talk about high school. We can talk about dentistry, and we can talk about endodontics. It's all parallel. They're just different places on the curve.
Yeah, and I always learn it the fastest when I'm learning a concept and say something, and then you say, "Oh, well, I already learned that concept in some other field." You know what I mean? And it's just the same concept, different example. I want to stay with oh gosh, you and it's gonna be so fun. I tell Phyllis to go shopping. Give her your American Express and just tell her to go out and play. You're not getting out of here alive. My gosh, I mean, I don't even know where to start. But one thing, I want to focus the most on the kids. I don't care what a bunch of grandpas like you and me that have money and grandkids. I'm mostly concerned about the COVID class of 2020. I mean, my older colleagues didn't leave me in a mess like this, and I'm thankful for that. So if they didn't learn any endo, and sometimes when they talk to me, they cry. They go, "I've never obturated, or I've done one canal, and I'm afraid to go apply to a DSO, who is the only people hiring." I mean, this is bringing up to date. Dentaltown is 21 years old, and we've had free classified ads, one of the most popular part of the sites, and there's always about 1,000 dentists selling their practice and 5,000 jobs. Now there's 2,000 people selling their practice. They're just done. And only 1,000 jobs, and they're all only DSOs. Nobody in private practice, after 40 million Americans lost their job, 30 million of those had dental benefits. That's why dentistry has contracted about 30%. I mean, we've gone from the pre-pandemic 100% level to about 71%. And so, someone comes in with a toothache, they need to learn, and you're using digital technology. So the Ruddle Show, tell me right now, could the Ruddle Show compensate these kids' lack of endo training and experience in the clinic and ramp them up better so that they could be a public health endodontist and start doing molar endo? Or would you, you have other digital properties, or is there other websites that you have that would be better for that?
Well,
I mean, would it be
we
the
have
endo?
different platforms, and if you're really, okay, I'm not going to be self-serving. There's lots of places you. Well,
I'm going to be self-serving because there's Pierre Fichard, GV Black, and King Clifford. You have two websites. You have Endo Ruddle, endoruddle.com, which is Advanced Endodontics, and then you have the Ruddle Show. So what my homies want to know succinctly is, what is the difference between Advanced Endodontics at endoruddle.com and the Ruddle Show? What's the difference specifically to the kids who don't have any endo knowledge?
Okay, so you want to learn, just make up a topic. You want to learn a little bit about obturation. If you want to learn a little bit about obturation, we have lots of stuff for endodontists and for the recent graduate on the Ruddle Show. This is an acronym that my family hates, but I came up with the words ill, like you don't feel well, you're ill. Ill is to inspire, to make people laugh a little bit, and to learn. So the Ruddle Show has real nuts and bolts learning every single show, but we also have my other parts of my family want it to be a variety show. Like maybe we talk to Howard, maybe we interview a titan of industry, maybe we find out new technology, what's coming to the market tomorrow. So we want it to be informative. We want you to laugh a little bit at yourself. We have some funny stuff on it, but yeah, it's about how to do endodontics. But if you really wanted to learn more like a student, you'd go to Advanced Endodontics, because there you can start from access cavities, and you can go into glide path management, and you can learn about instruments, how to shape canals, how big is the shape, how small is the shape, different ways to 3D disinfect, fill root canal systems. So there's more of an educational platform on Advanced Endodontics, but we've taken snippets from my life's work and what I'm currently still doing in my travels and stuff, and we're putting it on the Ruddle Show just to bring you kind of like news, endo news. And part of the endo news is what's new, new technologies, what other people are doing in other parts of the world. It's what Howard's doing. It's what some of the big bitches and complaints are. It's like how the agencies are misusing us. They're manipulating the meetings and big dollars, and they're not taking care of kids. So we go through all this stuff.
So the kids would do better on the
Endoruddle.com.
Endoruddle. Okay. Next thing they're thinking, I already know how their mind works. Next thing they're thinking is, what does it cost?
There's everything's free.
So the Ruddle Show. Oh,
I
forgot you're not divorced. Oh my gosh! So you kept her.
Yeah, I didn't have
years?
my empire 3 times.
Oh my gosh! Now I see why you stayed married for 53 years. You just wanted a free website. Man. My gosh! So if endodontics makes you feel ill, then log on to the ruddleshow.com and advanced. I always get mixed up. The Ruddle Show.
Well, the umbrella, Howard. The big umbrella is Advanced Endodontics, and then we have several entities. We have endoruddle.com. We have the Ruddle Show. I have the inventions. I have PDFs, articles. There's a bunch of things hanging down underneath Advanced Endodontics. That's just the name of the business.
Okay, so how do you like this promo? Because I can push this out to some people. If endodontics makes you feel ill, then log on to endoruddle.com and the Ruddle Show, where King Clifford makes endodontic shaping, cleaning, and obturating, turns the word ill into inspire, laugh, and learn. I'll have to work on that. I'll have to succinct that. That's not time for right now. Of the 3, cleaning, shaping, and obturating, give America's 150,000 general dentists that work 32 hours a week or more, a letter grade for each one of those specifically on the endo you're seeing in America, because we have data, we don't get along, people, dentists have a very dysfunctional relationship with dental insurance companies. But when you have a friend in the dental insurance company, they won't let me publish it in the Foran report or the Dental Town, but their data shows them that when endodontists do 1 million root canals, 5% of them end up being extracted. And when general dentists do it, it's 10%. So succinctly, why are you having 5% failure? Is that probably not cleaning, shaping, and obturating? It's probably not diagnosing it's cracked or something, but go over the letter grade for cleaning, shaping, and obturating for endodontists and general dentists, and try to bring out and illuminate why endodontists have a 5% failure rate and general dentists have a 10%.
Okay, I don't know if I even agree with those numbers, but
okay, well, that's great. This is Dentistry Uncensored. I mean, tell me what you think of those numbers.
Well, you're probably talking to the wrong guy, because to set this up properly, even by 1990, over 90% of my practice was retreatment.
Right.
That means out of every 1,000 patients I saw, 900 had already had endodontics. Sometimes they'd had retreatment and maybe even surgery. So,
but that's because, let's be clear. That's because you only treat immigrants. Because all the American dentists, none of their root canals fail. So to be doing retreats, they must have been done in other countries. Because I've never met a general dentist that had a root canal fail.
No, I won't say that. Wow. I guess
go meet a dentist who retires at 65 that did all his endo and say, well, how many of your root canals failed? You could count them on one hand. It's like, that's funny, because we have 4,000 endodontists, and what percent of the day of the cases of the U.S. 4,000 endodontist force is retreats versus initial?
Well, it depends on who you are. I still speak to I speak to countless endodontists almost every day, if not every week, hundreds around the world. You're emailing, texting, whatever, Zooming. But your endodontist is just like golf. You talked about Tiger Woods. So you can go look at all the pro golfers, and they all got their PGA card, right? But when you come to Sundays, how many are still in the last, 10, 15 guys? 10, 15 guys are out of thousands of golfers. So in the world of endodontics, I had over 1,000 U.S. endodontists come to Santa Barbara and train. That's about 1/3 of the nation's endo. Let me explain that. If you look in the book, there's 7,500, so you thought he's already bullshitting. But if you get rid of academicians, semi-retired, don't care, don't do endo, 1 day a week people, there's about 3,500 endodontists that show up every day and do about 80% of the nation's endo. So I had about 1/3 of those come through Santa Barbara. And a lot of them that came through, the guys that came out and paid $3,000 for a course, and the ladies that did, they weren't slouches. They really cared. And that's the most important thing we're not talking about. How much do you care? Are you passionate about what you do? Do you love doing it? Are you getting a lot of joy out of it? Or are you just cranking out white lines on x-rays? And so I would tell you, I didn't see a bunch of bad endodontists come out, because most of them didn't come out. I had another 1,500 general dentists. So we didn't have a lot of people, but this happened over from 1983 to when we closed the seminar business a few years ago. I was moving on to something else, the Ruddle show, and then I do one-on-one in the office, just one-on-one. The point is, your endodontists, there's probably 10% that are doing elite work. I would say there's another 25% that are doing really solid, everyday good endodontics. I would say we have a significant number of endodontists that are struggling. A lot of them don't know what they don't know, because if I trained with you and there's 2 students and you're my mentor and you're never there because you're in the research lab or you're raising money, who's training Cliff Ruddle? You already said this earlier. Well, that's exactly what's happening. So when the kids get out, they feel they paid a lot of money. Do you think they're going to say they got a terrible education? No, they're going to, I got a great education. I trained from Harry. Harry wrote 3 books. They're this tall, and I'm doing state-of-the-art, just what Harry said. Well, maybe Harry hasn't practiced for 35 years. So we have a terrible crisis in endodontics among specialists. And then general dentists draft behind us, and they're kind of watching what we're doing. We have endodontists. Okay, we have well-trained general dentists that are as good as any specialist in the country, okay? And I would say there's always those passionate dentists. You see them at every course, right, Howard? They're junkies. And this year they're doing the continuum on restorative. The next year they're doing a continuum on implants. The next year they're doing endo. Those people are really great dentists. And I see a lot of AGD people come through and they're going for fellowship and mastery. They care. They really want to get the hours. They sacrifice a lot. They're away from their family, their kids, their practice. They're losing money, but they want to get better. So I see that as a very narrow spectrum of endos and well-trained GPs. And everybody else, I want to encourage them. They're not bad people. These are good people. But a lot of times we don't know what we don't know. You know, in the old days, it was really cool to go out. When I was in Boston, my second year, I was going to start a practice in California and Phyllis was going to help me. But I didn't know how to practice. So she said, get your ass out and start looking at offices. You only have a year left. So I went to 50 specialty offices in the greater Boston area and sat for one day and watched how that person was working. I learned more about how I didn't want to work, but I learned a few things about what I might steal and borrow and have Phyllis help me integrate it into my operatory. So if you don't know what you don't know, how can you make a correction? A lot of people that hate endo, they just never got to sit down next to maybe John West and feel the joy of reaching length. And then moments later, having a shape where you can fit a cone. And then packing down with warm rubber and filling root canal systems, you see their faces. You see their eyes. They love it. So I've been teaching how to treat root canal systems, not root canals. That's my whole thing. When you go to Boston, not all Boston schools, not Tufts, BU and Harvard at that time were the ones that taught systems. They were the only two schools in the country. When I came to California, I was the 8th endodontist to do warm gutta percha. Now, warm gutta percha isn't a ticket. It's not a free pass to the future. It just means there was a certain philosophy that we believed in anatomy. So filling root canal systems was part of that philosophy. So not to be too hard on your general dentist colleagues and even many endodontists, when I go to the Doc Matters, this Gentle Wave podcast, it looks like to me, I would say 80% of the cases are something that you would say if I said, Howard, A, B, or C, D, or F, you would say they're C's, D's, and F's. And then if I told you they were done by endodontists, you'd be shocked. You'd be absolutely shocked.
Wow, you're telling me. I just want to get this number right. Of the endodontists, 10% are elite, 25% are what?
I would say very good.
Is that the number you said though? 10% are elite,
yeah.
25% are very good.
Are very good. They're very competent. They're well trained. They can do things.
And then
you always have your Tiger Woods. You always have your Kopka. You always have somebody that can do incredible things with the ball. So we're going to have that in any endeavor in life. And then we're going to have a lot of really good players. Okay, we have a lot of really good endodontists. But I would say 50% of the endodontists, they need courses. They need work. And a lot of times we sit in our walls, Howard, and we go home at the end of the day and we're tired and we get up and we do it the next day. Where are they getting their training? And then COVID came. And now we have everybody going to these Zoom chat rooms and different places, and they're showing their short fills, and they're talking about how wonderful it is that they're doing a $70,000 disinfection idea. So I'm trying to say to your audience, it's not the technology. We all use technology. We rely on it every day, but it's having a clear idea in your head what you're trying to do and understanding how to cut an access cavity, understand how to negotiate canals. That is a skill that is so deficient around the world, is sliding instruments to length repeatedly, deliberately, and intentionally. Not just wherever they go is where they go. It's like knowing how to get to length.
You know, I used to always think that at Creighton, Creighton was, I grew up with 5 sisters, and now I get to go live where there's 88 boys on every floor. I was just in heaven. And that's why I hate democracy, because, if Monday Night Football came on and then the Oklahoma play, I had to sit through a musical. Oh, my God. So I'm up there with all those boys, and whenever they'd have a math question, you would listen to their question. I just wanted to find out what they're thinking, and you could tell with math so brutally that they basically had memorized formulas and were trying to plug them in. They had no idea what they were trying to do. They had no conceptual idea. So then I would try to backtrack, like, what are you missing to where you could show up with this math question, totally clueless. But we're only at 85%. 10% are elite, 25% are good, 50% are well-trained, or are very good, competent, well-trained, and the remaining 50%. Can I just change that to the remaining 65% for mathematical reasons, or is there another 15%?
No, just make it. I just made that up, but I mean, look, I don't want to come across as arrogant or cocky. I want to make people better. I want people to have fun with their endodontics, and they're going to be doing this for a long time, probably. And, you know, you and I are still going, and I don't see any reason to quit. What would I quit for? So as long as you're having fun, you have your health. So I want to inspire people to find things they can do that they can excel in, and then do them well. And a lot of us in the old days, we used to go watch people work, like I was mentioning in Boston. I was going there to see how to do an operatory, but I was watching how they worked. And a lot of that is missing. We don't have the mentorship where, you know, you go learn how to cobble a horse. You go to a smith, you know, he'd show you how to do it, and then you would be doing it. So we don't have that so much anymore. And we pass things on superficial. I don't like the brightest student in the room. They skip steps. If you look at intelligence, people that are really smart, their mind is always racing. They're way ahead of the teacher. And the thing is, when they get stuck in the clinic, like on a broken instrument removal drill, all of a sudden they can't extrapolate because they never learn each and every step that guides each case to successful completion. So I really think it's the basics, it's the fundamentals. And as you fumble around with your clubs doing the fundamentals, you suddenly can get it down the fairway a little bit. Now you got a little short game going. Now you got your greens rolling. That's endo. You grow into loving it. I don't know how many people just loved endo. We couldn't even see what we were doing. It was scary for a lot of people.
You dropped so many bombs that could be a whole show. You were talking about the file when Ben Johnson, his Protapers, when they came out, you know, there was the 02, there was 04, there was 06, then you started hearing people talking about it's removing too much tooth structure. And then I think that spawned off a whole nother movement, which I would call minimally invasive endodontics. Do you think going from, you know, the first 5 years I was a general dentist, I had a callus on my finger and thumb because I just sat there like Pee Wee Herman all day with these little files doing toothaches and Phoenix. And then when they came out with that engine-driven stuff, at first it was stainless steel and all that stuff. But when it came out to NiTi, it was really significant. I mean, it was fast. It was just better, faster, easier.
Sure.
But the down deal was that some people were saying, well, you're just tearing out way too much dentin. And I think that, do you think that caused the minimally invasive endodontics movement? There's that article, Minimally Invasive Endodontics, A Futuristic Approach, by Pritwish Mukherjee out of India. Do you agree with that? Do you think that the engine-driven NiTis remove too much tooth structure, which now the backlash is minimally invasive endo?
Wow, it's complicated. I'll try to be. So let's give McSpadden and Ben Johnson credit. 91, 92, more or less, was the advent of NiTi. Walya in 88 just passed away, but I had the pleasure of seeing him in Dammam, Saudi Arabia. He was the base dentist over there. Anyway, Walya invented NiTi, but never a file, just the concept. And then McSpadden and Johnson in 92, 93, 91, 2, 3, they came to market with the first two NiTi instruments. They were radial lands. In other words, they didn't have an edge, they didn't cut, they scraped, and they had U-blades. So that was the cross section. 3 lands, 3 U-blades.
What year was that?
91, 92, 93, right in there. And Ben Johnson's file was not Protaper, it was Profile.
Okay.
Profile. And so Ben Johnson gets tremendous credit. I credit him and John as the father of NiTi, with Walya being the guy that did the metal. Then
how do you spell Walya?
Walya is Walia. He just passed away in the last year.
And what was his first name? John?
Walya.
It's okay.
I can get it for you.
No, I'll find it.
I have lasting memories of sitting in the desert and the moon's coming out of the Gulf of Hormuz, and the moon is on his face. So that's the vision I have of Walya when you speak of Walya. Anyway, Then Buchanan came along just behind Ben Johnson in the middle 90s and launched his file GTs, and those were radial landed and U-blades as well. Then we launched Protaper in 2001.
Who's we?
John West, Pierre Machtou, Machtou. In French, Machtou means to chew. So anyway, it was our team that launched Protaper in 2001. That was kind of memorable. You didn't ask all this. I'm getting to the point about minimally invasive. But we were the first file in the world that was active. We were the first file in the world that changed the tapers on a single instrument. In other words, like an Eiffel Tower, we could make increasing tapers or we could make decreasing percentage tapers. Now, why am I telling you this? Because that was minimally invasive. In other words, if I say, Howard, you want to take a 2508 to length, if you ran 8% taper over 16 millimeters of cutting blades, it's bigger than a GG6. It's 1.53. It's like a redwood tree. So we realized that if you had 8% on the front end and then go 7, 6, 5.5, 5, 4.5, we could reduce the back end of the instrument so we didn't remove as much tooth structure. We didn't even know the word minimally invasive endodontics, so we started in 95. We launched in 2001. There was no word minimally invasive. We were minimally invasive. We were minimally invasive 20 years before people talked about it. So when people talk about these great big shapes, they need to learn Protaper, because Protaper has decreasing percentage tapers to keep residual dentin, to minimize the loss of tooth structure, especially in furcated teeth where we have concavities on the external side of the roots. So we want to make our shapes stay away from furcal danger. We don't want to root thin, strip perf, things like that. So to get to it, the shapes kind of from the 91, 2, 3, they were all over the place, too big, and we were flirting with, it was the blind leading the blind. We were breaking a lot of instruments, but by about 2001, we had about 8 years of NITI experience. Everybody started to get on board. Schools became more proficient. Faculty actually showed up and knew how to do it instead of just going like, wow. And so it was a movement that began. I would say about 20 years, 15 years into that movement, there was a small cult. I won't mention their name unless you want me to, but
Please.
I won't mention the name John Gottleman. I won't mention Gary Carr, nor will I mention Dave Clark.
Well, I'll mention Gary Clark's the only person in my life who kicked me out of a class because me and Dotola snuck into it and it was for endodontists only. And I said, well, that's like racism, sexism. I said, screw that. So I checked endo and went there, and it was all good until some guy said, Howard Ferran, and then he found out that I was a general dentist, and he said, out. And oh my gosh, I just thought to myself, this is the grossest experience I've ever had. And then they talk about, well, only endodontists should learn this. Hey, if you're listening, dumbass, 15,000 American cities don't have an endodontist. So when you say I can't learn from you, well, why don't you just flip off all of rural America? I'm from Kansas, so your dad was born there. I mean, anyway, forget Gary Carr. Elitist and wrong. Just wrong.
Those three guys started a cult. They now have about 1,000 people.
And
in fact, Gary Carr sold the dentist insurance. What's it called? TDO.
Yeah.
The dental office or whatever it is. He sold that to Son Endo. And I guess you see the relationship business-wise. If you're Son Endo and you're selling $70,000 widgets called Gentle Wave, then obviously if you can buy Gary Carr's endodontic only company, those are all clients that are pre-qualified theoretically to buy Gentle Wave units. And so they started this cult, these three guys, and now they have their own annual meetings. And you know what? We like to have a lot of fights and stuff. I would just like to say, if they're listening, you guys are okay. You don't believe like me. I don't believe like you, but it's not a new kind of biology. It's not a new kind of model. Gottleman loves to talk about this new biological model. You know what, Howard, you extract the tooth, does the bone fill? Howard, if you extract there's a big lesion, you extract the tooth, does the bone heal?
Yes.
And it didn't heal because you removed the crown. It didn't heal because you removed the cementum. And it didn't heal because you removed the dentin. It healed because you removed 100% of the pulp. Each time, every time, all the time. It's real simple shit. We don't have new models that these guys like to talk about, a new science, a new way to look at it. It's some kind of shaping, some kind of cleaning, and some kind of filling. And please restore the tooth. Please restore the tooth.
I love that. So you said it was the three people. Gary Carr. Who was the other two people?
John Cottamy.
John.
K-H-A. What is Colorado?
Yeah, Colorado. What's
and Dave Clark.
John Cottamy and Dave Clark.
Yeah, and they have this cult and they speak about it. But let me tell you something, Howard. If your audience went and watched my show, the Ruddle Show, I call it splitting hairs. You go to war. I'll see you on stage. Hey, audience, I'm psychodrama role-playing. This is not true. Howard's on stage. He's talking about endo, and he's holding up this file. And he says, you see this file with the red? This file makes a much smaller shape than this file. This file is a big file. It's blue. This is a big file. If you look at the cross sections, Howard, how big is a human hair? Let's give the audience a little lesson. Google, put in human hair / diameter. If you do that, you're going to find out that a small human hair is 0.6. Does that ring a bell? We have a pink 0.6 hand file. If you look at a medium-sized human hair, it's 0.8, 0.08 of a millimeter. That's like the gray handle on the 0.8 file. And you know what a really coarse human hair is 1/10 of a millimeter. That's a 10 file. So when you look at these two files, and Howard, it's important that we look at them at the same place. We can't compare this file here to this file up here. If we take cross sections at the same place, what you'll find out is most files, listen carefully, they're on the order of 5, 6, 700ths of a millimeter difference. So we have a whole commercial thing called minimally invasive endodontics, largely to sell instruments, largely to pound on our chest and say we're saving precious tooth structure. And to me, it's a made-up phenomenon. But I will say to the audience, it's a noble concept. Nobody wants to have their knee opened up the old way, right? You'd be out for a year and a half if you're a football player, linebacker. Now we can make 3 little incisions, put in a suction, put in a scope, put in a camera, and we can have people walking, in days and working out in 6 weeks. So I'm all for minimally invasive dentistry. It's kind of like I already started doing that with our team way back in 1995. Our file launched in 2001. Howard, it's been the number one selling file in the world. It's been the number one selling file in the world for 15 years. Phyllis, come over here. Did you realize we just did a show? If you lay all the Protapers end to end, they go from Beleg, Switzerland, just say the Eiffel Tower, and they go across Australia, and they go clear out to the West Coast, Perth. That's how many we've sold. So everybody tries to gun us down. Everybody wants to be Protaper. Everybody knocks us off. David Clark and Cottamy went to SS White.
What's Cottamy's first name?
John.
John, Khatami?
D.
K-H-A-D.
K-H-A-D.
D as in dog.
And then E-M-I.
Yeah.
E-M-I, okay. And we're okay.
And these are good guys, but they're driving a philosophy that's it's blocking, I think, common sense. But back to this minimally invasive. So I was going to have you tell him whatever show it was where we talked about splitting hairs. You could probably find it right there in season 2. So this is the binder for season 2. So there's 10 shows in here. She's going to try to find you. It doesn't matter. But
is that free too, or is that supplement
it's all
money?
Free.
So you're going to build them a binder and then mail it to them?
No. This is
our
internal.
Okay. It's PDFs. Okay.
But our show has notes. It has references, bibliographies. If I talk about you, it takes you to your website. It tells you what you're up to, whatever you want me to say about you. So our show is not just me, blah, blah, blah. We have a lot of guests on. But back to minimally invasive. The audience should hear, of course, our access cavities can be too big and blow out tooth structure and weaken and cripple teeth. Of course. Of course, our shapes can be too big and strip perf or thin roots and predispose into longitudinal fracture. Of course, our apical thirds, we try to get big stiff files around curvatures so we can make these big. That's ridiculous. That's old-fashioned endodontics. We need flexible files. We don't, see, the thing is, Howard, the audience needs to know, your young dentist, files don't clean anything.
Show 15.
Show 15 in season 2.
Well, the one thing I love about John Kademi is huge economy. God, he's got 2,000 posts on Dental Town. But what I love about him is he takes the witness stand. You know what I mean? I mean, he'll get on that forum and he'll, OJ didn't take the witness stand, but old John does on Dental Town out of Durango. And my classmate Larry Swallows up there loves him. But so I have love for John Kademi, but Gary Carr, dude, you need to make that right. I mean, you kicked me out of your class from Kansas trying to learn how to do endodontics. I'm across the street from the Guadalupe Indian Reservation. Guess how many dentists and endodontists they have? 0. And you don't want me to learn how to do better endo? This is back in like the 80s and early 90s, and I just thought that it was actually the grossest event I think I ever witnessed. So thank
Howard,
you for that, Gary. You are number one.
Let me tell you this. I got banned from speaking at the AAE for 8 years because I taught non-surgical retreatment to general dentists in Santa Barbara in groups of 10. And I don't make the phone ring. So it could be an endodontist, a general dentist. Our groups were usually about 50-50. So I'd have 5 GPs, 5 endodontists, and we're taking post out, broken instruments, pervs, blocks, ledges, transportations, got to purchase silver points, carriers, and paste fillers. We're doing all this. And finally, the AE said, you can't speak at the AE because you're training general dentists to do what we do. I hate that.
Well, you
to me, there's no experts.
I mean, if they sent you a letter, email, whatever, out them on it because it's gross. Because at the end of the day, we didn't go to dental school. I mean, what I love the most about dentists that you see very different than a lot of other deals. We spent 8 years learning how to heal people with our hands to get them out of pain. And there's nothing more cool feeling for a fireman when he pulls up to a house on fire or a policeman catches a bad guy is when someone walks into my office and they're holding their face and they got, a cup of ice and I can fix that. I mean, that's just so cool. And for someone to say, well, we're going to withhold information from you, that's what governments do. I mean, it's lack of transparency. I mean, everybody knows this with political science that when governments are opaque, they're evil. And when they're transparent, there's checks and balances. So, and it's still in 2020, it's that way with ortho. You only have 2 board certified orthodontists who can speak. And one's Richard Litt out of Detroit. The other one's Harry Green out of Phoenix, Arizona. And every orthodontist will tell you the same story today. Well, if I go do a lecture teaching general dentists how to do Invisalign, my own orthodontist will divorce me. And that's gross.
Yeah.
I mean, you're either patient-focused or you're dentist-focused. And if you want to stand there and look in the mirror all day, then go be an Instagram influencer. But if you're a doctor or dental surgery, you need to learn all these skills. And it's actually a very bad investment because I went to Creighton in 1980. Warren Buffett would come over and lecture at our business class because he knew the guy at Creighton. And I was so dumb, I thought he was an idiot until it took me years to find out that he wasn't some old man idiot because he didn't own Kodak and he didn't own any of the 50 Nifty and he owned all these, lame companies that just shoveled out cash. But he always talks about he doesn't like companies that always have to reinvest a lot of money. He like Coca-Cola. It's just sugar, carbonated water, and it just keeps growing and growing and growing. He does not like companies that need more investment and new materials. And when I look at these dentists with an FAGD and MAGD, I always think to myself, that guy spent $100,000 on it. He could have had a boat, a red car, or a cabin at the lake. But what do my homies want to do? They want to go blow their $100,000 on how to be a better dentist, and the orthodontists have a feeling that they won't even teach you, and if someone does, they'll be mad. That's gross, and it's wrong, and they should be outed for. I mean, it's just anti-patient evil.
McClammy, Tom McClammy?
Tom McClammy?
He's in your area. He's in Scottsdale.
Okay. Well, those are the rich people. I'm in Phoenix. I mean, you have to have a 9mm to drive through my neighborhood. He's up in Tom Miller, you say?
McClammy. Tom McClammy. MC.
Oh, yeah.
Capital. Yeah, you
Yep.
know of him.
Yep.
Well, he's a friend and he's a fabulous, like Cotomy. So the audience hears, I don't believe in Cotomy and some of his cult-like minimally invasive, but John's a smart guy. He's very, very smart. Well, so is Tom McClammy, and Tom McClammy was a general dentist in Oregon. And I was up speaking to the Oregon State Association of Endodontists. This is some years ago when Tom was a general dentist. He had one of the biggest practices in all of Oregon. Tom said, I hear you're coming up to speak to the endos. Can I come? I said, absolutely. Anybody that wants to learn, I'm taking learners. So Tom came in that day with me. He picked me up at the hotel. No endodontist did. And he picked me up and chauffeured me in. And they asked him if he would register and where did he practice. He's new face to them. And he said, well, I'm a general dentist. I practice in Willamette Valley. And they said, well, you can't come. And I said, wait a minute. He's a great young general dentist. He's probably better than some of the people in this room. And they said no. So then I saw some guys come together and there was a little group talking and they were talking about McClammy. Could he come or not? So I went over to the group and I said, is there a problem? I said, Tom's just a student, wants to learn. To make a long story short, I finally had to say, Tom is going to take me to the airport and I'm flying home. I'm not doing this day unless Tom McClammy's on the front row. Your choice. Well, Tom was on the front row all day. But that's really bad when our society plays God, because really I've noticed dentists, they just want to learn. I don't make a distinction between an endodontist that wants to learn and a general dentist that wants to learn. I see two students who are wanting to learn.
And he has the Horizon Dental Institute here in Scottsdale, Arizona.
Yeah.
I've emailed him several times to come on the show. I don't even know. Maybe I don't have the right email or whatever. But how would you succinctly describe the Horizon Dental Institute's teaching on endodontics versus your programs?
Well,
how are they different?
Tom, I would say what's the major difference is when Tom came and took all my classes as a general dentist, I taught diagnostics, rationale for treatment, access, clean, shape, and pack. Okay, I taught all that. Then I taught all the non-surgical treatment. Then he came back and took all the microsurgery stuff. Then he got passionate and went to endo school. Then he became an endodontist, trained with Herb Schilder, and went to your place, your region. What he teaches now at Horizon Institute is gentle wave. So that puts Tom and I a little bit on different pages, but I want everybody to hear this. I don't care if you get gentle wave. It'll clean your root canal system. My point is, let's not fool people and make them think they have to pay $70,000 and throw away a $100 handpiece every single time they do a root canal so they can clean a root canal system, because Tom knows how to clean a root canal system exquisitely without gentle wave. And of course, he can do it with gentle wave.
And that's why I always try to teach the kids, hold up your hand, is because people are always asking me ideas. And by the way, guys, you always send me these NDFs. You want me to sign a non-disclosure agreement. I mean, that's why I tell you not to get married. If someone loves you and wants to spend the rest of their life, then do it. But when they say, oh, but if you decide not to love me, here, sign that we're going to get married so that I can steal all your money. I'm not signing a non-disclosure. All I do is dentistry. I mean, I don't feed the lawyers. But I always tell them to hold up your hand. Is it faster, better, easier, higher quality, lower in cost? And if you got all 5 of those, it's a no-brainer. 4 of them, it's probably a great idea. But with dentists, it's always, I've got the best idea how I can do this more expensive, slower, and on less people, and the kings and queens are going to love it. I'm like, dude, this is America. We cut their freaking heads off. No one cares about the kings and queens. Henry Ford, the first thing he focused on, there were 86 car companies, and no one remembers their name. You remember Henry Ford because he was the first guy that said, you know who really needs a car? The working man. And, if your best idea is to make something more expensive, take more time for less people, great. But don't tell me about it.
All the best things in endodontics, and I think largely in life, they're pretty much free. I mean, it's a choice how you start your day. It's a choice what kind of patients you see. It's a choice what kind of work you want to do. It's a choice what kind of shape you want to make. And if you want to get better, you just keep working at stuff and maybe narrow your focus down and get pretty good at what you are good at. You know, to always follow your heart.
Yeah, and my two oldest sisters are nuns, and one of them read, every major religion known to man, and she always reminds me that there's not a name of a person, a city, a place, that shows up in every religion except for the golden rule: treat other people like you want to be treated. And she sends me a list of where it's first found. I mean, it's first found in Hinduism 5,000 years ago. Every religion picked up on that. And so that should be the palm of the hand. Is this how you would want it done on you? You know what I mean? And now at my age, when I started thinking about DSOs and things like that, I'm thinking about my little granddaughters. When Grandpa, right now, Grandpa will fix your teeth for free. You don't have to worry about anything. But when I'm dead and gone, or the great-grandchildren or great-great, what is dentistry going to be like for them? And if all the dentists are working for a Wall Street banker, then where's my granddaughter going to go when she needs a dentist? She didn't go to Wall Street to fix teeth. She went to a dentist. And if the dentist is a paid shill for Wall Street or an insurance company, then whatever. But my granddaughter will still need a dentist.
Mm-hmm.
As long as there's a granddaughter for my dentist for my granddaughter. My gosh, Cliff, we're going to probably go till midnight. So back to that letter grade, though. We were on the letter grade about general dentist. I want to go back to, do you believe, and I spoke for some dental insurance convention in Florida just not too long ago, just a couple of years ago, and there's like 350 or 400 the dentists were the clinical dentists that were reviewing claims or whatever. And man, it was so fun. And we had so much fun. But they're the ones showing me that when you guys do it, 5% fail. When general dentists do it, 10%. Do you believe that numbers? I mean, they were showing me data, but we were at a bar, so I don't even know what I was looking at. But do you believe that endodontists have a 5% failure rate at 5 years as measured by the tooth has been extracted? Because they're not going to get in there and debate whether this lesion is healing or any of that stuff. Just, you did a root canal. 5 years later, we have proof it's gone. And that happens 5% of the time with endodontists, and general dentists is 10%. Do you believe that?
Probably at 5 years. I mean, the thing that we're really not talking about, to me, most cases that we do, Howard, I think you would agree with me, and from your perspective, because everybody has their frame of reference, I think almost anything we do in endodontics works for about 5 years. And then what really separates out mediocre cases from the great cases, assuming they're properly restored, is time. And time is the great equalizer. So I don't know that I believe it's 5%, because I could quote you other studies where maybe it's closer to 91, 92% done endodontically. I would think general dentistry could be even in the 70% if you want to look at 5 to 10 years. Just a lot of stuff leaks coronally and fails endodontically. I mean, that's one of our biggest causes of failure is coronal leakage. Okay, well, then let's address that, because when I say this, people are, you wouldn't have to be very, to say, well, is he just doing that for money? But when I started doing endo and I read all about the coronal leakage and the crown leaks, I'm like, well, why did this tooth die? And then I would, I have the option. I can save the crown, so that's just a $100 lab bill, and drill this little hole through a PFM, which the patient hates because they see it. And then I got to do a root canal through this little hole, and I just say, screw it, man. I'm just taking off the crown, and now the tooth, 2-3 millimeters lower. I have bigger access. But so many of those crowns you take off, you could just see the trail of ants. Are you an endodontist?
You can just see the trail of ants that's causing this. And I'm thinking, well, if you would have drilled through the crown, you still would have left it on there. So I always take off. I will not do a molar root canal underneath the crown and save the crown. I mean, my goal isn't to save the crown. It's to save the tooth. And I just feel like I can do much better endo by throwing that crown away, see what's underneath it, get all the decay out. So do you agree with that or not?
I totally agree. I offer courses how to do coronal disassembly, and I don't mean saw it in half, use a crown splitter, throw it in the wastebasket. I'm talking about how to remove restoratives intact with the notion you'll put them back on post-treatment. But I like what you said, and you can help me as an endodontist because you have a big influence in the market. I heard you say you took the crown off and you made a nice access. I don't know exactly the adjective you used. Was it a big access? It doesn't matter. It doesn't have to be huge, but you got it opened up. And the big wow in Santa Barbara for 25 to 30 years was wow. The wow was, if I made, now listen, don't take this wrong. If I made my access as big as you, Cliff, I could do it. Well, shit. What's stopping you? But I mean, with reason. I mean, there's a dentist on the other end that's got to restore the damn thing. So we have to maximize residual dentin. But when you got that crown off, that was restrictive. Now you could see. And you know what you didn't tell the audience? You probably went from a 25 millimeter file to a 21 millimeter file. Well, now your fingers are closer to the end of your file. Now you have more dactyle control.
And you don't have 3 links of 22, 19, 8. They're straight. And then if you got 2 that you're sure of, but you're not sure of the third, but the other 2 are 18, well, it's pretty damn likely the third one's 18.
Yeah.
And
so
that's why I also don't like those rubber stoppers. I hate those things. You're filing the stoppers. I like those laser serrated things. I think when you're using a rubber stopper, it's like you know that thing moves, right? Yeah. I mean, do I have to hand him a yardstick and say, hey, play with this yardstick for an hour and see if it changes length?
Well, you just said it. Use the circumferential depth gauge rings.
Yeah, I just didn't know what that word was. Circumferential depth gauge rings. I love it when I learn something on my own show. You're so amazing. But back to the letter grade. When you look at those failures, do you think it's diagnosis, cleaning, shaping, or obturating? Put those in the order for the endodontist, or if you need to do it separately for general dentist. But when we look at that fatality rate, where 5% of molars that had endo were extracted at 5 years for endodontists, and 10 for general dentists, is it diagnosis, cleaning, or shaping, or obturating?
Well,
what's the weakest area of that chain?
We should probably add another category. I mean, we do know there's radicular fractures, so I have a whole.
Well, that was under diagnosis that you didn't pick up. It was fractured.
So, and then we have missed anatomy. I mean, the maxillary molar, like 90% of the time, has an MB2. It's the most frequent cause of failure. It's the biggest tooth by volume, the least understood, the most researched. But anyway, that big MB root, if you take that tooth out and do a postmortem, you know how broad that root is. Well, that root has 93 or 4% of the time, statistically. We can put a file in it, take it to length, shape the canal, pack it, count it. You can't count it if you get a little catch. Yeah, I think it's there, but I can't get through it, can't count it. So it's there over 90% of the time. Clinically, histologically, if you just do sections, we can say 100%. So we have to know our anatomy, and that's back to diagnostics, because mandibular molars, we have the second system in the, distal root. We have radix perimolaris, we have radix entomolaris, that's the little extra root. We have taurodontia, we have C-shaped molars, we have 3-rooted bicuspids. These are all in your grab bag of diagnostics, but there's an old slogan, know thy anatomy. So if you know your anatomy, you know where to look and why to look, and you're going to find a lot more. And then, of course, if you throw on a headlamp, a poor man's microscope, even the dental assistant can hold a fiber optic wand above the rubber dam or below the rubber dam while you're drilling in up above, and she can transilluminate and flood light buccal to lingual, and that'll give you more light on your pulpal floor as you're drilling down from up above. So those are little tricks for people that don't have scopes, but they could wear a headlamp and use transillumination.
Okay, I want you to say something very succinct, because I know my audience, man. And you and I mean, we've been on the road. August 4th was my 30-year anniversary, and you can't be a rock and roll band or an educator without staying on the road, so you actually get to meet the real people. And they went to become a dentist because their mom was a dentist, and her mom is her idol, and she wants to be just like her mom. And she routinely sees all of her mom's molar root canals, and her mom has found 3 MB2s in the last 40 years, but thinks she's a master of endo. So when you go back to work and you're 25 and your mom's Dr. Phyllis and she's your mom and she doesn't ever find MB2s, the young daughter, how many times when she obturates should there be at least 4 canals in that radiograph?
90% of the time.
So then what should she tell her mother, who's the love of her life, who's done it 3 times in 3 decades?
I think you give your mom a hug. We don't hold ourselves to the standards of the 40s, the 50s, the 60s. And we're different, and we were trained different. So when people come in, and the first question I want to know after the niceties is, hey, Howard, when do you think it was done? Well, if you say it was done a few years ago, I'm home free with my language, my verbiage to you, because I can say we've learned a lot. We know more about the anatomy. We have different technology. Boom, boom, boom. If it was done yesterday, it's harder because it was missed, okay? But I don't hold anybody accountable for missing canals from the old era because they hardly ever even were told they were there. And a lot of times, if your MB1 and 2 merge, which they do about 60% of the time, by inadvertently missing one, you might have sealed it inadvertently by sealing the other one. But that means the reciprocal number is they're separate, distinct, and unrelated apically, so they have more than one portal of exit. And so if a case looks good, it's asymptomatic, it's a patient, and it looks like to you they might have missed a canal, bone looks good, chew equally well left to right, no pocketing, you just watch it. You don't jump in there and do something on her mother's old root canals.
Man, I wish I would have talked to you earlier because I told her she needs a new mom. I got that totally backwards. My gosh. There's so many things I want to talk to you about. The same insurance convention, that's telling me this data, which, that's just the data I saw, also showed that apicoectomies are just going the way of the dinosaurs. I mean, they've been drifting downwards for 10, 20 years. Was that because of implantology or endodontics?
Both. And now the pendulum swung again. Now more and more people, where can I take a microsurgery course? Who's teaching microsurgery? I got nothing in grad school. Now I need to flap a case. So as the implant, I had a guy call me. This is unrelated, but he's a retired guy. Should I say his name? Yeah, I'll say his name.
Hell yeah, it's Dentistry Uncensored. If you're offended by this show, unsubscribe and quit watching it.
No, the old guy. Sam Ursu. He's a professional opera singer. He's the only dentist that's ever tried a case at the Supreme Court. He was appointed by Aliota, who died. The guy never took insurance. He had people travel from all over the world to do his work. Every time I'm with him, I don't ever say a thing. There's nothing I can ever say because he's talking very quickly. But he's in his late 80s now, and he called me last week.
Is he an endodontist?
He's a dentist, a general dentist. In fact, Herb did a lot of his root canals. And then he finally said he got smart. He just told me this story. He got smart. He went back to Boston. He said, Herb, who's your best student? I'm going to take him to Michigan. He's doing all my endo. My patients can't fly to Boston anymore. They're getting too old. So anyway, Sam Ursu called me, and he's been talking to me about the implant for years, like Cliff. He thinks implants are fine. He thinks that we should do them, when it's appropriate. But his bitch is when we don't know how to disassemble and take teeth apart and give the tooth a long-term result. I'm not talking about go through a lot of time, energy, effort, and expense, and you extract the tooth. So Sam's whole point to me, he calls me out of nowhere, 2 years. He goes, Cliff, how do you clean the first thread? And I said, what are you talking about, Sam? Sam, what are you talking about? He said, the first thread on the screw. How do you clean it? I said, shit, I don't know. He said, well, that's the problem. When you go to court, Cliff, how do you clean the second screw? Tell me. So it was an interesting question. There's no answer, but his whole point was, let's not tear a tooth out of the mouth until we have something better to replace it.
Yeah, and that's another shift that's clear as a bell for me. In 87, Orthodontic Centers of America had gone when I graduated, gone public on New York Stock Exchange. There was a dozen on NASDAQ. They all folded for the exact same problems they're having today. They went away for 10 years. Now they're back. Same thing when I got out of dental school. Periodontist was your main man, and they were showing you hand scaling and surgeries and all these things to save your tooth, which back to religion, treat other people like you want to be treated. I don't want to have my molar extracted and bone grafted and implant. I want you to save my tooth. And everybody's like, you know what, this is bullshit. Let's treat this with forceps and titanium and pull it. Well, they did that for 10 years. That wasn't a miracle fix. And now you're starting to see the tide go back and say, you know what? Let's try a little harder to save that failed root canal or that perio-involved tooth. Do you think that's a better trend?
The trend that I think is going to be powerful is now that we've had implants from their inception, it was like, all over the place, growth spikes. You had that great interview with the guy that passed away.
Carl Mesh.
Yeah. So, when people like that knew how to do it, maybe fine. But we just had cowboys all over the world just saying, new income stream, took a weekend course. We had people like Buchanan saying any monkey can drill a hole in the bone. Well, that's the easiest part of the implant. I've had 2 implants just recently because I had 42-year-old root canal fracture and fail. I almost pulled my lip down to show you how.
But I mean, be honest though. Why did Phyllis punch you?
Well, that was another story.
Okay. Is that for another episode?
But the point is, now that we saw the maturity and then we started to have more science, more observations, more education, a rising tide raises all ships, we kind of got to the top of the implant game. Metals got better, designs got better, coatings got better. But there is this thing called peri-implantitis. There are failures, and we know at 10 years the difference between implants and endo are no difference in the literature. So now I think a lot of people realize that endodontics, Howard, is a regenerative procedure. Duh! It's a regenerative procedure. And if we can grow bone, even if we lose the tooth, the vertical fracture, we'll have a better site to place an implant in the future. So yes, to answer your question, the pendulum is swinging. People want to know more about retreatment. My life work has been in retreatment. I've written 5 chapters in international textbooks, about 50 pages of all the chapters. I'll say them real quick for you. Coronal disassembly, missed canals, gutta percha removal, silver points, carriers, paste fillers, metal and non-metal post removal, broken instruments, blocks, ledges, transportations, and perforations. Those fields are all growing.
Okay, say that again. Say that again. I don't type that fast. Coronal disassembly.
Oh, I didn't even know you were trying to type, or I would have been more respectful.
Coronal disassembly.
Yeah, it can include removing, all types of dentistry, onlays, bridges, and splints, missed canals, the removal of the common fillers, gutta percha, silver points, carriers, carrier-based obturators, CBOs, and paste fillers. Removal of post is another whole chapter because that's metal and non-metal. And now in the age of aesthetic dentistry, we're seeing a lot of, tooth-colored restorative post.
Well, and your buddy Ben Johnson, that was the first pushback when he came out with Thermofill. Is that you were leaving a carrier in there, and that was an extra thing you'd have to disassemble, and that was the major pushback for Thermofill. Remember those days?
And Howard, you're smart. Remember the early ones? They were metal. They were metal carriers, like a file.
Yep.
Anyway, when you interview him, he'll tell you how he had the kids use the oven in the kitchen, and they painstakingly put gutta percha around the flutes of a file. They had to put it back in the oven. They had to heat it up and get it to elute to the file. Then they take it clinically and slide it into the root. But they had the metal file left. And when to your point, that was terrible. You guys wanted a post space, you had a broken file. So anyway.
And I just want to say, if Ben Johnson's listening, that my gosh, the fact that you sent me that oldest root canal video, I posted that on our Dental Town YouTube channel. So it's youtube.com. I don't know what it is. Anyway, it's youtube.com/Dental Town Magazine. It has over 6,000 views. The comments are off the chart. And Ben paid a shitload of money for that. He didn't charge me a penny for it. But here's the thing why I love Ben. I was born and raised in Wichita, Kansas. He's like a 2-hour drive south to Tulsa. When I came out of school, when he came out with all this stuff, I called him up on the phone, and we didn't have internets and emails and all that stuff. And I was telling him all my problems. He goes, dude, this is too much for a phone call. Why don't you just jump on an airplane, fly to Tulsa, and spend the day with me? And I'm like, seriously? And then when I got there, I spent the whole day with him. And it's like, well, I need to go find a hotel. And he's like, why, you think I don't have a house? And, the nicest guy on the planet.
He is.
And when I would, and I knew he was a genius because when I would say something about the space, as he was explaining to me, he was laying out perfect geometry. And I said, anybody that can lay out perfect geometry, I mean, talk about having the concept of what you're talking about before you do it. I mean, his math skills, I don't know. I mean, obviously he's a legend in endo, but I would still say his math skills were even better. But anyway, sorry to interrupt. So keep going.
Well, a damn good ball player. Got a tryout with the Los Angeles Dodgers, and he played college football.
And that's why he took a ton of his money and built a new stadium out there for the college football people.
Yeah.
Ah.
And then if you get him on, be sure to ask him about his lure. He's invented a lot of stuff in endodontics, as we've talked about, but he has a Nai-Tai lure for fishermen that has done probably better than his file business.
Seriously?
Seriously.
It's done better than his.
If you're a fisherman, you probably don't even know it. You're using his lure, some internal component.
Yeah, I'm from Kansas. I never use lures. It was always worms. Just.
Well, I referred my fishing.
You referred your fishing?
Yeah, I referred it all out.
I refer my fishing out to Long John Silver's. So do you see the rise? So are you predicting right now that the billings to insurance companies for apicoectomy retrofills are going to launch a comeback? Because people are going to disassemble everything that failed and try to redo it better, faster, easier, higher quality, lower in cost?
Well, I know you exaggerate on purpose. There will be more and more dentists moving towards their preoperative film as a previously treated tooth. There's a lesion, and they're going to have to make a call diagnostically, rule out fractures. It's restorable, healthy, or can be made healthy periodontally. Is it worth the time, energy, and effort? Let the patient decide. Share the information. It's not Ruddle's call. It's the patient's call. And you're going to see a renaissance in retreatment, whether it be non-surgical or surgical.
Wow.
And again, our problem will be education, because we used to teach those things. You go to grad schools today, there's like 51 or 52 in North America. You talk to the grad kids, they're doing almost no surgeries. They're doing almost no retreatments. And it's just like when I was in Boston, I worked in a little clinic off campus in the nights and on Saturdays to help pay for the family stuff. And it was Mattapan. It's a ghetto. And basically everything you go through is carious exposures right into the pulp chamber. Then you come to Santa Barbara and you're drilling through 10 inches of gold to get to the pulp chamber. So it's a different kind of dentistry. But residents are seeing a lot of carious exposures and doing their cases that way. They're not seeing a lot of really sophisticated, a failing abutment under a splint or a bridge or something.
And you said something else also profound. A lot of these young kids are going to come out. They're going to buy some older guys' practice, and they think that just doing the endo is the problem. You've got to sell the dentistry. But dentists hate the word sell. Remember, when you're a dentist, you're not trying to change the patient's mind. You're trying to show the patient their mind. And if you can just listen to them and then show them what they're saying, then they'll be able to see their own error versus the way you're seeing it. So, just if you can't explain it visually, it's like why I like stand-up comedy. I had movie stars reading scripts with 20 deals. I don't even like Carrot Top because he comes out there with all these props. What I love about stand-up is there's no props. It's just you and the audience. Yeah. And when you're a dentist trying to explain stuff, the best ones are just like a comedian. No props. They're just listening to you, and they're trying to show you what, like a magician is tricking you. They're showing you something, and then they change it. And a great dentist is listening to what you're saying and trying to show you so you can see what you're saying, and then you'll see the obvious folly in what you're thinking. And
so
that's
you
how
just
you sell
gave
those
the
big
audience
cases.
a wonderful lesson that I don't know that they heard. So I'm going to repeat what I think you said. So sometimes it's Saturday afternoon. You don't have time to go to the ball game, but you turn the ball game on. And you're washing your car, you're mowing your lawn, you're doing 1,000 different things, but the announcer is painting such crystal clear pictures in your mind. You see the runner on first base, the pitcher's going into his windup, you're right there. You see the guy break 30. He paints such great pictures that it's just your podcast. They see it because the words are so powerfully expressed. So I think what you've learned in your podcast, if they're watching it, great. But if they're listening to it, a great teacher can teach a lot by just visual images they put in your head. And I thought that was important to come back to play off of what you said.
And if you need Casey and a chalkboard and draw a lot of notes, just have your assistant explain it to the patient, because most dental offices, almost 80% of them, have at least 3 other people that aren't a dentist that work there full time that can sell 10 times more dentistry than a dentist. I mean, you're a doctor of dental surgery. You couldn't sell a car. So that's a skill that everyone needs.
So should we make some money for your group today? Should we play a little game and make them some money?
Hell yeah.
All right, so write this on a piece of paper. So everybody's assignment is to get a piece of paper. And I want them to write on the paper this, that they have 1,000 patients. Okay, they have 1,000 patients. Now, if they're just out of school, they don't have any patients. And if they've been out for 5 years, they have way more than 1,000 patients. But let's just we're all psychodrama role playing, got 1,000 patients. And the question is, and let's say that each patient has 20 teeth. They could have 32 teeth, they could have 28 teeth, but they could have 20 teeth. So you could say what, Howard? That every dentist is the custodian of 20,000 teeth. So if we make a table, and it's called misdiagnosis, what if you missed endodontic diagnosis 5% of the time on 20,000 teeth?
Yeah,
and so the audience knows Howard is writing this down, so we're letting him come along with his notes. But you got 1,000 patients. They all have 20 teeth. I just made that up. It's not true. So you're taking care of 20,000 teeth. You love each tooth. And if you didn't take care of each tooth properly and didn't diagnose it 5% of the time, the question of the audience is, what's 5% of 20,000?
What is it?
1,000 teeth.
Oh, okay, yeah, okay.
So you missed 1,000 teeth. What if every root canal cost $500? I just made that up. Howard is the insurance czar in the United States of America, and he declares effective immediately August 21, all root canals will be $500 US. So you could tell your audience they're sitting on $500,000 of undiagnosed endodontics at any given moment of time. And let's continue. What do most endodontically treated teeth get post-endodontics? They get a crown of some sort. So again, now I'm the insurance czar for North America, and I declare all crowns, whether they're tooth colored or solid gold, they're $500. So 500 and 500, your audience is sitting on $1 million of potential business if they just checked it out. So here's what dentists love to do. Drop the mask, dental smoke blowing through their hair. It's a marvelous feeling. They're doing crown prep. And all they did is they looked at the periapical film. They go, yeah, it's clean. Bam, bam, bam. Doesn't hurt. Let's go. They have no clue what the status of the pulp is. So I'm trying to get your audience to start doing vital pulp testing. And it doesn't have to be them. It could be the assistant. It could be the hygienist. They should have a record. Part of the record should be a little endodontic insert that tells you 1 through 32 what the hell's going on. All you need is percussion, cold, hot, and that more or less the pocketing. There's a bigger exam, of course, discolored teeth, mobility, palpation, all that stuff. But if they just start pulp testing, and the reason they're not finding the 5%, because they're only doing percussion and looking at films. So Howard, Sam Seltzer in the 50s had his kids, his residents, take mandibles, section them anterior to posterior into 2 halves, took 6 and 8 round burrs and scooped out the marrow bone, put the halves back together, handed the films to trained periodontist or endodontist and said, when do you see the incipient, the early lesion? Nobody saw the lesion until the students took part of the medial cortical plate from the buccal or the medial cortical plate from the lingual. And only when the cortical plates were infringed on did the endodontist say, there's the early lesion. Now, obviously, CBCT comes to mind, but how many people have CBCT? About 5%. How many people have microscopes? About 5%. So about 95% of our dentists don't benefit from CBCT or microscopes. So these dentists, I'm trying to say, when they take a film and look at it, Howard, and they say it has an intact PDL, everything looks fine, you don't know what you don't know, because you don't see the early lesions until there's a lot of destruction. Here's another way to say it. When you raise a flap and go in to clean out a lesion, did you ever say to your assistant in your entire career, gee, it's a lot smaller in here than it looked like on the film?
Yeah.
It's always bigger. So the thing is, if we can just get colleagues to start doing vital pulp tests, that's usually a cold test. If they don't complain of anything, it's a cold test. If they complain of cold, it's a cold test. If they say it's coffee, it's a hot test. And I'm not going to go through that today, but that's all on the website. It's all for free. If they want to run hot and cold tests, they don't have to be doing this personally. Now, obviously, it has to be legal in their state, but most states
don't say that. That's because that's what turns everybody into sheep. I mean, I remember when I first opened up my office, I hired my third hygienist, because we were so busy. And I didn't know anything about it. Then the Arizona State Board of Dental Examiners sent me a certified letter saying that in Arizona, you're only legally allowed to have 2 hygienists. So I don't know how they found out I had 3. And I wrote them back a letter. I said, well, fantastic. Come down here, look at all the hygienists, tell me which one I need to fire, and then go through all the charts, which one I need to start treating. And I said, and then we'll hold a press conference and you can explain why dentist has to fire a hygienist because of the Arizona State Board of Examiner. Oh, yeah, and I forgot one thing. I also said, yeah, and never heard from them again. Because they expect everyone lives in fear.
Why didn't you take the 3 and say that every third day you will be my number 1 assistant and you 2 are hygienists and we just rotate the hat? No, you did a better job. You just
if everyone would just quit living in fear and quit taking all this crap, they have no idea how many. I mean, do you know when the Civil War when we went to war with England, do you realize historians say only 40% wanted to, the rest didn't, and 10% of the whole country flew to Canada. That's why to this day, 90% of the Canadian population is within 100 miles of the U.S. border. They just wanted to cross over the border because the mighty United Kingdom, the British royalty, they didn't want to mess with that. But 40% of Americans were for it, 60% are against it. And we went to war with them because of a tax on our tea, and we don't even drink tea. So if right now, I think more people are pissed off at their government around the world. I mean, right now they're rioting in Hong Kong, Belarus. Our streets have been crazy. I mean, so dentists, you can't even get dentists to stand up to professional organizations, insurance companies. I mean, you massively changed endodontics. I'd like to be the first Jimmy Hoffa of dentistry. I mean, these dentists need to start standing up for dentistry. Otherwise, our future generations are going to have to go to Wall Street or insurance companies to get their health care. And that's not how the system works. When you need a doctor, you need a real doctor, not an MBA Wall Street analyst. So don't get me started on that. But living in fear is not an option. No. So, just quit living in fear. So I'm going to go back. Again, she goes out and she sets up with her mother, and her mother does all the endo. But come on, do they really irrigate? I mean, are they really disinfection? I mean, usually that is 1 syringe of bleach at the very end, 4 paper points, then sealer and dill. Can you talk about disinfection?
Yeah, you just said it all. Look at a 25, an irrigating syringe with a 29 gauge cannula. You're talking like the syringe is 25 cents. The cannula is maybe a couple bucks. You can I'm using about 30 to 40 cc's of irrigant for every tooth. And you just said it.
How much? 40 cc's?
30 to 40 cc's or
Come on,
mLs.
this is America. They only know metric when they're buying ammo for their 9mm or grams of cocaine.
Just like a lot.
30
Because-
cc's is
Well, it's
30
like
to
that
40
little
cc's.
syringe you just talked about. That's a 3 cc syringe. So I'm using 10 of those.
Okay.
Well, the thing is, then I'm agitating my solution because a reservoir of irrigant is like a toilet. It just sits there. It's like you fill the sink up to shave, if that's how you shave, and it just sits there still. So we have to use agitating devices that move the irrigation. You learn a lot by just watching. So go into any convention, go down to an endodontic workshop course, and just start strolling behind the students. They will use one syringe to do an entire procedure. And that's what they do at home. So we need to increase the volume of reagent. And to be specific, I irrigate after every single file. I don't try to outsmart myself. Somebody goes, do you really have to irrigate that frequently? No. But if you start to have discipline, so Howard, here it is, file goes in, let's just say it won't go to length. Well, you come out, I irrigate. So whether I go to length or I don't go to length, when I take a file out, I dump 3 cc's every time I take a file out. And it doesn't take any more time. I mean, I don't put my syringe cannula very close to length, Howard. I get upset at manufacturers because they look at the lectures, they see that there's a lot of root canal system anatomy filled on post-operative films, so they think, well, the secret's irrigation, so let's build smaller and smaller cannula so colleagues can get their cannula closer and closer and closer to length. Well, then this invites sodium hypochlorite accidents. So I don't really go anywhere except just below the orifice. I don't have any need to put my cannula to mid-root or around the curve, because the way we irrigate with the endo activator, that's a product that I invented. So I want the audience to know I have a commercial involvement, but it costs $500 for the basic kit.
The endo activator?
Yeah, it's capital ENDO, capital A, one word, endo activator.
Capital NDO.
Yep, and then activator, all one word with a capital A. And the endo activator moves polymer tips, Howard. And these polymer tips are flexible. They don't break. They don't cut. This is what's important. They can go around curvatures. And I'm not going to get into the nodes and the antinodes and ultrasonics versus sonics, but ultrasonics by definition vibrates metal. Metal cuts dentin. Even if it's smooth metal, it cuts dentin. It can ledge, it can break, it can perforate. So I'm making a big deal. We're vibrating polymers, flexible, non-cutting. And we do this for 1.5 minutes a canal. And we have 90,000 users around the world. I'm very proud of that. Many people that were using gentle wave are now back to the endo activator because they don't see any difference in getting more anatomy with $70,000. Every disposable tip, $1.80. So it's $1.80 per patient. Less than $2.
Well, I know you don't need any marketing. I mean, you're a legend. I mean, really, you're the king of endo. But my God, why? And you've already got all these courses. Dentaltown has 40 online CE courses. They've been viewed 1 million times. So
Wow.
if you probably got 1 million hours of video. So if you made an endo activator, pro ultra piezo CE course, it's gonna explode your websites.
Huh.
I mean, they already
have
exploded
that
to begin.
content. I have that content.
Yeah, well, it's free marketing for your websites, endoruddle.com and theruddleshow.com. And but anyway, but that was a great answer to that. And I know you're running out of time, and I'm not going to be running you late and all that kind of stuff. So I'm just saying, what do I have to ask you?
Howard, we could reconvene in another year, 6 months, 20 years from now when we've really got it figured out.
Okay, I just have 2 more questions.
Take your time.
Young kids, two questions. Young kids out of school routinely ask, what is a glide path? And is that a necessary thing? And then the last question, I'll just throw them out there to hold myself. Microscopes. I'm a dentist and I'm an MBA. You know, family first. My 4 boys, that's first. But next, I'm a dentist and a businessman. And microscopes, I mean, when I got here in 87, every endodontist in town was doing 8 to 9 molars a day, and they were crushing it. And then they bought microscopes, which, I mean, you might as well just chop their legs off, and now they're doing 4 to 5 molars a day. So obviously, you sell more $10,000 cars than $30,000 cars. But do you think microscopes kind of turned endo into two markets? You're either going to buy a Mercedes for $1,500, or you're going to buy a Chevy for $1,000. And do you think some of these endodontists with a microscope now think they're neurosurgeons or trying to reattach the inferior alveolar nerve? Or what is your view on that rant?
I'll do the microscopes and then I'll come back to the glide path. With the microscopes, you know, there's an old expression in life: you only know what you see and you only see what you know. And then the other one I like: if you can see it, you can do it. So probably they went from 8 molars to 4 because they saw a lot more. They found MB2s, they found mid-mesials, they found extra roots in the distal of lower molars. They found things and they became a little more picky and they slowed down. Sometimes we talk about slowing the game down in sports. Look, I was the first guy on the West Coast to have a microscope. Gary Carr came to Santa Barbara and actually watched Cliff Ruddle use the microscope. And I'm proud of him. He went on and did his whole thing. I'm not proud of who he became, but he's very smart and he's very good at the microscope. But my point is, you can do world-class endodontics with just a headlamp. I did it for years. I didn't have a microscope, and I still found 4 canals in the maxillary molar all through the 70s and the 80s. I didn't find my first MB2 with a microscope. I already knew where to look. So I would say to general dentists, you do not have to have a microscope to do world-class endodontics. You just have to do basics. Isolate, have the rubber dam, make a nice access cavity that you can see, wear a headlamp, have transillumination devices. That's a poor man's microscope. So I would say that a lot of endodontists are desperate to save the profession. They're so desperate that you don't even probably know this. We have battles all the time. Are we going to lose our professional status with CODA? And oh my God, what's the ADA going to do? Chop us. So you have a group of endodontists that are incessant on always thinking if they could get you to use gentle wave at a microscope, they could just get you out of the market. And all of a sudden you send it to us. We're the big boys. We do it like the neurosurgeons, as you said. I see all this as adjunctive technology. Fine, you get off on it, use sleeve guides, do all that shit. That's what you want to do. Then some people found out it was the XNAV for implants. It wasn't sleeve guides and all that bullshit. So I would encourage every general dentist, if you're doing 6 to 8 cases a week, you love it, you know, get a little light scope for about 12 grand, pull it over for endo. You might use it for margins, whatever. But you do not need a microscope to do world-class endodontics, because I know too many general dentists that do. They send me cases. I see their work. They're playing above the rim, Howard. They're playing above the rim.
Well, I'm a 5'7" Irish guy, so I've never even seen the rim.
Do you want to hear the glide path bullshit?
Yes, absolutely.
Okay, they want to know. Let's start off with, this is a file. Here's a secured canal, Howard. I could take my nose and push the file to length. So a canal is called secured when I can take a file, a small size stainless steel hand file, Sundays and Mondays, evenings and mornings, later, early, and anytime I want to, I can just slide the instrument passively to the full working length. That's a secured canal. So what's a secured canal? It's a canal that has a smooth, reproducible glide path. And a glide path means that there's a hole that's available for that file to slide through. So our hardest job after access is securing canals, because that's the skill. The skill is to negotiate, slide, slip, and glide your way to length. And when you do that and you have a super loose 10, I can teach anybody from any country in the world to shape. Endodontics is like this. Irrigation is fast and easy, no skill. It really, I hate to say it, there's no skill in disinfection. There's very little skill in obturation. Our skill is opening teeth, finding canals, and negotiating them, not on some days, but each day, every day, all days. And that's what's usually missing. That's when you have broken files, ledges, blocks, transportations. All the negative stuff you hear about shows up when we don't have a secured canal.
No more questions, but I just have to clarify on behalf of our Joey D. Dubkin, who passed away. My gosh, he was born in 61, and he passed away October 21, 2013. But he always was so funny because he divided all the endodontists into two people. There was the apical barbarians that like to get to the end of the puff a sealer out, and then there was those damn pulp lovers. Are you, on behalf of Joey D, are you an apical barbarian or a pulp lover?
I'm a barbarian.
And then his second question was, he was a squirter. Now we're, the single cone technique. Joey's, when you start doing hot gutta percha, that's a whole nother level. Are you, what was it was an apical barbarian or a pulp lover, a squirter, or what was the other? He was a squirter. What did he call the non-squirters?
Well, maybe the heathens, but the guy that started that technique came and took all my classes. He lives in your area. He's retired now, but his name is John Stropko. And Stropko was the original first squirter in the world, and he taught it quite a bit. And when you pulled John aside, he would say, well, guys have trouble fitting cones, Cliff. So they can take a really small cannula, like a 27 or 9 gauge cannula. They can slide it around the curve and start squirting thermosoftened GP from the apex up. And then Joey and John were good friends. They did courses together. You probably know that. They did surgery courses together. John was the surgeon. Joey was beaming these surgeries to Venezuela at that time and all over the world. He was doing things that people said was impossible, so Joey just did it. So I think squirting is fine, but you better have a good shape. Because Howard, look at my hands. Yeah. It's the shape that gives you the resistance form. If I squirt gutta percha into parallel sided walls, gutta percha doesn't have any resistance. So I need deep shape, a conical preparation that has resistance form, because that holds your thermal softened gutta percha inside the root.
Well, man, you're a legend. I'm going to let you go because I don't want to piss off Phyllis, because it sounds like you had to have a root canal done after you pissed her off somehow and she punched you and fractured that root and had to dig out a root fracture. But dude, you're a legend. You've done so much for me personally, everybody I know, every great endodontist I know, you're their man. I mean, when they start talking about it's you. And I've been trying to get you on this show for 4 years, and every time I'd email you, you reply back, Howard who? But you finally came on the show. I attribute that to Phyllis. She probably just made you. She probably said, get this guy to quit harassing us. Get on the damn show, and then we'll block his email account. But thank you so much for all that you've done. Family first. Congratulations on 53 years, 2 kids and 5 grandkids. That is amazing. Business second, endodontics. Man, you're supposed to leave the playground better than you found it. And I can't think of only people like you left endo better than you found it. And that's, my God, that's the best thing ever, man. And you're a great friend. So thank you for everything.
Howard, it's a big honor to be with you today. Our family loves you. Even my daughters read your email and they said, gee, he knew my name. How did he know my name? Well, the people around the world that know Howard knows who you are, because that old expression, they don't care how much you know until they know how much you care. So I want to just write back at you. You've been a great inspiration for me. And I want all the dentists on this show to realize that I might have strong opinions about stuff, but really we want to grow every dentist a little bit, every day, a little closer to their full potential, okay? They all have greatness in them, and we just need to unlock it. And the last thing is my favorite quote: whatever you can do or dream you can, begin it. Boldness has genius, magic, and power within it. So best wishes to all your audience, and we'll have to do it again, and I'll have you on the Ruddle Show.
And you should just tell the kids that it doesn't matter your endo skills, but if you could just make each root canal you do next a little better than the last. I mean, if you could just make each root canal 1% better than the last one you did, man, you're going to be the greatest endodontist that ever lived.
Right.
Just be a better version of yourself tomorrow. If you're having problems with your kids, be a slightly better dad tomorrow than you were the day before. But just be on a constant diet of self-improvement. And you've led 2 million dentists around the world, treating 8 billion people. There's about 6,000 humans for every dentist. And you've been making hundreds of thousands of those dentists better than ever before. And I just want to, one final story. I'll never forget, I was lecturing, I don't know where it was in Africa. I think there's like 58 countries, and I've been to like a third of them. And because of YouTube and videos and things like that, 30 years ago, at least 100 countries, if you had a toothache, you needed a pilot, not a dentist. You just need to get the hell out of this country. But because of internet stuff like what you're doing, you can get a damn good root canal in every country on earth because they're listening to guys like you digitally. So keep being digital, which can scale instead of going there in the flesh, and talking to 20 people. But thanks for changing the endodontic world.
Thanks, Howard.